All right, everyone, it is our favorite time of the week. Time for Rise and Cues when we answer your questions. Saagar, what's up first?
All right, first question. This is from Carlos Aponte. He says, the bank I use for my small business in aviation had the gall to tell me we're taking care of our big customers first. I had to be one of the first to put in for the Paycheck Protection Program. Do you guys think banks will be held accountable for these practices? Hashtag Rising Cues. Well, Carlos, no, I don't. I don't think anybody will be held accountable for these practices unless you hold them accountable, but with your public outrage about this situation.
Yeah, that's it.
I don't know how other way to say it.
That's really the bottom line because there's so little oversight of any of this. The only real oversight is through journalism. We saw the report come out in the New York Times saying that big banks were giving their biggest customers concierge service. And here's the thing is that this was so predictable. I mean, we knew that this must be what was going on before that reporting even came out, in part from anecdotes about,
just like Carlos.
Chris and what Carlos is saying here, in part from people who had reached out to us. But it was also predictable because you know how these banks operate. The big guys, they're going to have, a similar amount of processing in terms of how much time and effort and labor would go into it, but you get much bigger fees. So all the financial incentives for these banks were to go to the big guys first. And I think the only accountability we'll see is through journalism like what the New York Times did and from public pressure. But anything actually from Congress, other than maybe some lip service, I wouldn't hold your breath.
Don't hold your breath, Carlos, though there will be a sternly worded letter.
That's right. Well, listen, at least they were honest with you, I guess. They didn't lie to you. They're like, yeah, we're taking care of these people first. So Disgusting. Disgusting.
Right. What's next? Let's take a look at the second one.
Second one, how can the left pressure the Democratic House majority to introduce a 6-month rent freeze? Is the only option a rent strike? Look, I think one of the things we talked about here this week is that the left needs to learn some of the tactics of the right. The right is willing to be villainized. They're willing to actually go out in the streets, taking risks and forcing people to do what and it has had some impact. Georgia's reopening basically because of these protests that have been going on. I don't support their aims or their goals, but you can take a lesson from their tactics, right? Pressure the House majority to not just go along with the Republican bill, to actually stand in the way and get accused of, holding up essential aid in order to get actual essential aid to the people. Now, I don't have much confidence in the people here in actually doing anything, any of the legislators here in this town and actually getting themselves organized. So yeah, I think a rent strike, I think actually being in the streets, refusing to follow the orders that they want you to follow, to dramatize that. Look, I think those are the sorts of tactics you have to think about, as sort of radical as they frankly are.
Yeah, look, nobody's going to give it to you. You have to take it. And if you're going to take it, you got to be willing to really be hated. And so, yeah, if you want a rent freeze, then you're going to have pressure your representatives in order to actually be absolutely despised by their own leadership, by the others, by the media, by financial elites, have hundreds of millions of dollars of ads run against you, and have the hope that all of you will still come out and back that person come November. Now, I happen to think that that's exactly what people should do if they want to fight for what the people actually want, but don't see very many people on the left. And then this is what I always say, which is a lot of people talk a big game, but whenever it actually comes down to it, Mama Bear of the Democratic Party, willing to say one person will vote for it, but I'm not organizing an organized revolt. I'm like, well, maybe you should.
Yeah.
You'll actually get what you want.
Well, and here's the thing with the rent strike, because that hits people who do have money, who do have the ear of Congress, then suddenly...
They'll freak out.
Then suddenly they might start to pay attention. All right, what's the last one we've got? Have the arguments presented by your co-host changed your position on any issues? Saagar, what say you?
Do I have to go first? God, this is a hard one. I've had to think a lot more deeply about the healthcare system. Honestly, on the right, we don't really talk about healthcare as much. It's not the top concern for a lot of voters, and it's not something that people really engage on. I kind of missed politically the repeal and replace Obamacare debates. Just because I found it all silly and technocratic and stupid, and I was right.
That was a good non-use of your time.
Yeah, yes. I've had to think a lot more deeply about the healthcare system. I'm not sure. Honestly, even today, and that's why I call out the hospital industry so much, is because I still think that you can preserve some of the system that you have right now without throwing out the entire thing. However, you need massive systemic level reforms to providers.
Yeah.
And I think that one of the things I hear the most from Sanders and AOC and the progressive left is about the insurance industry, and I think that's great. But at the end of the day, like in France, doctors get paid 40% less. And
yeah.
A lot of healthcare costs actually goes to providers. The problem is everybody likes their doctor and everybody likes their nurses. And we give concierge level healthcare to our citizens. Like everybody in America, if you get checked into a hospital, you get a private room. In Europe, it's an open ward. It's not as nice, but it's a lot cheaper. So there's a lot of different ways we can think about provider level healthcare that I've never had to think about it, like I said. And it's actually sparked an interesting conversation with me and a lot of my friends and people who think about right-wing populism. But what do we think about healthcare? There's not a single answer, but at least we're thinking about it.
Yeah, I think for me, there's been a lot of kind of deepening and coloring in some of the shades in my views that Saagar has helped me with. I mean, I always at least paid lip service and intellectually held the idea that you can't hate people for how they vote, that you can't have contempt for them, you can't think they're better than they are, better, whatever. But actually grappling with ideas from the right every day has really deepened my understanding of why people would make the political choices that they do, and I think has deepened my level of respect for voters and the choices that they make with a very, imperfect set of choices that are before them. I think that's a piece. I think immigration, similar to how, you've been pushed on healthcare, I've been pushed to think more deeply about immigration, what the right policy is, how you can support a more restrictionist policy without being a racist and those sorts of things. So I've definitely learned a lot here every day and been forced to sort of grapple with my own views in a more specific way than I had previously.
Yeah, and I think that's helped the audience, both right and left. We hear about
so.
It all the time. That's one thing everybody loves about the show. All right, so if you guys still have a question, you can submit them, #RisingQs, Instagram, YouTube, Facebook, Twitter. We check them all, and we'll see you guys next week.
Have a good one, guys.